Good morning, everyone, and welcome back to the hashtag This Works webinar series brought to you by the Philippine Economic Zone Authority and World Health Organization Philippines and the Department of Health. We are glad to have you back on day 3 of our webinar series. We've been already through the first 2 days where we discussed our initial waking up. Let me just move this. Okay. Waking up, going to the workplace, and then yesterday we discussed what to do when you are at the workplace. Today, we are going to discuss, or rather answer the question, what will you do if you or someone else at your workplace turns out to be sick? Paano na kung may magkasakit? What happens if you think someone starts coughing, someone has a fever, someone calls in? For those of you who are occupational and safety health professionals, what do you do? Who do you call? Not the Ghostbusters, definitely. So we have 500 already attendees inside the Zoom room, and I'm looking at the YouTube side of things. 450 and climbing, 423 rather, and climbing going up. There you go, 530. So we anticipate, thank you so much to everyone who has been tuning in with us. So we have a lot of repeat participants, repeat viewers, and we hope that our content is really making sense. And just to remind everyone, so here you go. Today is the 3rd day. The question is what to do if I am or someone else is sick. We have these speakers from WHO and panelists from PEZA and some of the locators inside. I'll be introducing them later as we go along. But not to forget, this is our promise. There have been a lot of people asking, Doc, pahingi ng slides. Doc, nasa na po yung slides? Ninyo po ini-email sa amin. Not to worry, on the right side of your screen, you can see a QR code which allows you to download the slides. There will be a shared Google Drive folder where all of the slides will be posted at the end of the day after each webinar. And then we are asking everyone who was with us yesterday to please give us feedback. The QR code on the left is linked to a website which allows you to tell us where can we improve, what are the strengths and weaknesses of the webinar. This is our way of gauging how we can deliver the data, the information, the tips better to you, especially tomorrow because it will be our last day, but who knows, there might be another series coming up. And for those who want to review the footage from yesterday, that's day 2. The center QR code will link you to the YouTube video footage from yesterday's webinar. All right, so going back to today, this works, day 3, what to do if I am or someone else is sick. Again, my name is Dr. Albert Domingo from the WHO Country Office in the Philippines. Let me just introduce to you our 2 speakers who will be, or rather 3 speakers, who will be delivering today's lecture. Let me just put it on. Here we go, gallery view. So those with video, can I invite Harold and Tom to please show their videos? All right, so there will be 3 speakers this morning, beginning with Dr. Raj Yadav. Dr. Raj Yadav is a medical officer who also works as the team leader for communicable diseases and COVID health operations in the WHO country office in the Philippines. Maybe just a quick hello, Dr. Raj, by audio, please.
Hi, everyone.
Thank you. And then Mr. Tom Hyatt. Tom Hyatt is an epidemiologist at the World Health Organization Office for the Philippines. He has over 13 years experience at WHO, focusing on tuberculosis, leprosy, rabies, and health emergencies, including the COVID-19 response. Magandang umaga, Tom.
Magandang umaga, Albert. Maraming salamat sa invitation na nandito ako sa inyo. Thanks.
Hindi po nagbabasa ng script si Tom, talagang nagsasalita siya ng Tagalog. All right. And the 3rd speaker will be Mr. Harold Doroteo. Harold is a public health specialist at the World Health Organization Office for the Philippines. He has over 8 years of experience in health systems, including policy research, governance, project management, and organization development. Currently, he is the contact tracing czar. He is the contact tracing sub-pillar lead of the WHO Philippines Country Office for our COVID-19 response. Good morning, Harold.
Good morning, Dr. Albert. Good morning, everyone.
All right. So we go quickly. Just a quick review of the format. There will be 30 minutes where Raj, Tom, and Harold will be discussing today's topic on what to do if you or someone else is sick at the workplace. And then after the first half, we will go later to our moderated question and answer. Stay tuned. As most of you already found out from the first 2 days, a lot of the action in this webinar happens during the second half when we get Q&A from our audience. For those inside the Zoom room, there is a button at the bottom of the screen, Q&A, it says there. Please use the Q&A function to type in your questions. If you see a question that you want to join, that you support, click on the upvote, the thumbs up, and I as moderator will be seeing it first on the list. And then for those in YouTube, not to worry, you are still part of the live broadcast. I can see the live chat room. For example, Belinda Villa Esther is saying a blessed Thursday morning to everyone watching from you, Bataan, Davao de Oro. Wow, all the way from Mindanao. So I read that greeting just to show you that we are actually live even on YouTube and we can see your comments. Ayan na, bumabati na silang lahat. All right, so having said that, I'll now turn over to Dr. Raj. Dr. Raj, please go ahead and share your screen. You have the floor.
Okay, thanks, Albert. I'll share my screen. Please confirm that you can see it.
Very clearly.
Okay, everyone, thanks for joining this third day session on This Works. And yes, we are confident that whatever we are saying definitely works because they are evidence-based and proven approaches. If you do as we are discussing over these 4 days, this is the third day today, then the chances of getting COVID is very, very, very low. So let's see what I have to present today. What to do if you're sick? That is one thing that I will discuss. And the other thing that I'll discuss is what to do if someone else is sick, whether it's in the workplace or at home or anywhere. So first of all, you need to know how to know you are sick. And as you may have read on Google and WHO websites and DOH websites, these are the common symptoms: fever or chills, cough, shortness of breath or difficulty breathing, fatigue. You may also have muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea, vomiting, and or diarrhea. So as you can see, these are like flu. Flu symptoms are also similar, except that COVID symptoms may be a little more than the flu symptoms, a little more than severe than the normal flu. And the most common symptoms are fever or chills and or cough. Those two are the most important. Some people may have no symptom. They are called asymptomatic or non-symptomatic, and they may also spread infection. Sometimes when you develop symptoms, you start spreading infection 2 days before you get the symptoms and up to 2 weeks after the symptoms start. So in short, fever or chills and or cough, they are the most important symptoms, but some of you may not have that and still may spread infection. So we have to focus on what I'll be saying now on how to protect yourself and your colleagues at office and family members at home. So what to do if you're sick? That's the question I'm trying to address today. Many of these ideas apply for those who test positive without being sick. So if you're found to be positive in the lab, especially with the RT-PCR test, then you may still use these ideas even if you're not sick. So what do you do if you're sick? First thing you need to do is go home and stay home. So don't go around to go to the office or don't go to the shopping center, shopping malls, just go home and stay home, plus consult your care provider. This care provider may be a barangay health worker, your family physician, your workplace physician, your workplace nurse. Contact a care provider. That's very important. If you're staying with others at home, then rapid isolation is essential. If you're staying in a dormitory, try to avoid going to the dormitory because we have seen explosive outbreaks in dormitories. So you need to go to your care provider first if you are living in places that have lots of people. If your home is out in another province or another region, try to avoid going there until you are sick and until you have recovered. So while you are sick, you need to rest and hydrate. This is the most important step. As with any fever, you have to hydrate. Otherwise, you lose your water and minerals and you will become more sick. So hydration is important. You can take any home fluids. You can take coconut water if you like. Avoid the scary media. Yes, media informs us, but also misinforms us. So while you're sick, try to avoid the scary media, including social media. Of course, you can visit WHO websites, Department of Health websites, and other reliable websites, but avoid the scary media. That's very important. Stay connected. This is another important thing. Stay connected with your friends, your loved ones. That's important. That will help you to recover faster. For your cough, you can take warm lemon honey water. This is recommended by WHO. This is recommended by all big agencies. It is this taking this is as good as cough syrups in most of the cases. So you can try that, or you can take a cough syrup if you like. That's also fine. But if you are going to buy cough syrup or paracetamol for fever, try to avoid going to the pharmacy yourself. Send somebody else. And our body does the rest. Many people ask the question, what treatment exists for COVID? There is no treatment, but our body is the best treatment. If you manage the cough and fever and other symptoms, you will be fine. Most of you will be very fine. So, but in case you become sick, very sick, then you have to seek care, especially if you have difficulty breathing, shortness of breath, persistent pain or pressure in the chest. Also, if you have mental confusion or changes in alertness, drowsiness and or difficulty waking up, pale bluish face and lips. All these, or at least most of these, are due to low oxygen in the body. So COVID-19 causes low oxygen in the body, and that's how people die. So until you develop these symptoms, you're fine. You don't have to worry. But if you develop these symptoms, you're still fine, just that you have to seek care quickly. So in addition, you can monitor your oxygen by using this finger device. You have to just wear it on your finger. It's called oximeter or finger pulse oximeter. If the level goes below 93%, as per local advice in the Philippines, that's the level. Global advice is 90%, but that's fine. In less than 93% means you have low oxygen. This device costs like 700 pesos to 1,000 pesos. I'm not suggesting everybody should buy it. But if you have high risk of getting COVID, and particularly if you have high risk of getting severe COVID, then this may be a small investment. 700,000 pesos may be a small investment. But again, if you can't buy, not a problem. Just monitor your symptoms. If they become worse, approach your care provider for advice and management. If others are staying with you, then you need to cover your cough and wear mask and shield. Actually, you should be doing this even when you're not sick. You have to wear mask and shield even if you're not sick. But of course, in homes, sometimes we can't do that all the time. But if you're sick, you need to definitely wear this even at home until you're isolated. Clean your hands as frequently as possible. You can use water and soap for 20 seconds to 1 minute, or you can use hand sanitizers with appropriate levels of alcohol. It should mention 70% alcohol or at least 60% alcohol. Clean the surfaces with appropriate disinfectants, especially surfaces where other people in your family may touch. Isolate quickly. This is important to protect your family. So first of all, you could isolate yourself in a separate room while you're waiting for healthcare provider to provide advice. If you don't have separate rooms, at least, as I mentioned, wear mask and shield and keep your distance. Keep 2-meter distance. Just to be, you have to be safe, maintain 2-meter distance and until you're isolated. Do not share items. If you have to share items, you have to really wash that with soap and water, or your family member has to do that at least for 1 minute. Okay, more about wearing mask and shield. This is one of the most important things to beat COVID, whether it's at the whole household level or at the global level or regional level, anywhere. These two things are most important. And you have to wear it correctly, otherwise it makes no difference. Yesterday, somebody visited my home. I try to avoid inviting people to my home, but it was urgent that somebody comes and fixes something. Unfortunately, this person was wearing this shield up on his head. It was tilted over his forehead. So what's the use of wearing? So I had to tell him, please lower your shield. Also, sometimes people wear mask, but below the nose, their nose is exposed. That's wrong. These masks and shields are not just to protect yourself, it's to protect others. So when you're speaking, singing, sneezing, coughing, or even if you're not doing all that, please wear mask and shield, especially when you're with others and especially when you're sick. What to do if you need to seek care? And that, of course, is important when you have emergency warning symptoms and signs, as I mentioned earlier. First thing you could do is, even today, you can download this app called Pure Force Citizens app. The Department of Health recommends this as a way to help you access care, especially when you're sick and have emergency warning symptoms and signs. So you can download it, and this is how it looks. There are three views I have shown, and this is where you can click to get advice. I downloaded it a few days ago, and by mistake, I clicked there and then I canceled the call immediately. But I got a call within 3 minutes asking me whether I was fine. So that was magical to me. It was that they called me back. But just don't click on the upper buttons. There is something called President that will connect you to Duterte. I have not checked, so I don't know. And there's PNP chief. Try to avoid calling them, unless, of course, you need to call them. And the Department of Health also recommends all these numbers. You can check. Some people have complained that the numbers are always busy, but well, you can either call these numbers or call your general health care providers. Generally, they would know what to do. And there's mental health crisis hotline. If you are feeling stressed, depressed, even in non-COVID times, you can approach this hotline. You'll be helped. What will happen at the health facility if you have emergency warning symptoms and signs? The best treatment in such situations is called oxygen therapy. That's it, as simple as that. You're given oxygen and you may still be smiling. See, the person is smiling, so you don't have to stress. And our body does the rest. The oxygen will not kill the virus. It's the body that kills the virus. Oxygen therapy will help your body to fight. It will help you to survive while your body is fighting. This is one of the most effective treatments for COVID-19. So there is no treatment to cure the disease because the body cures the disease, but oxygen therapy prevents death. But unfortunately, for some people, this may not be enough. The body is not enough, especially if you have all these diseases: high blood pressure, diabetes, heart disease, heart attack, stroke, chronic respiratory disease, cancer. These are the common ones. So, but even if you have this, don't worry. Of course, you have to worry and take care of yourself, prevent COVID. But if your blood pressure is controlled, your diabetes is controlled, if all these diseases are under control, then you have to worry less. So for example, you have to take less salt for high blood pressure, less sugar for diabetes. You have to do that even if you don't have these diseases: less salt, less sugar. And for all these other diseases, you have to stop smoking if you're smoking, and stop alcohol if you're taking alcohol. Some people take little alcohol, but WHO says no amount of alcohol is good for health. You have to stop if you can. But smoking, definitely have to stop. Otherwise, it's also a risk factor for worsening and death. What to do after recovery? How would you know if they have recovered? Of course, you want to get recovered, you have to go back to your workplace, you have to get back to your social life as much as possible in these times, but still you have to avoid the crowd. So WHO has released a scientific brief which talks about what can be done. WHO is very clear. No tests are required to confirm recovery. In very few circumstances, tests may be required, especially if your job is to work with people who are at very high risk, like in aged or elderly people's homes and things like that. But generally, no tests are required. Then how do you know you have recovered? According to WHO, if you had symptoms, then 10 days after onset of symptoms, you have recovered. But also you have to look at the symptoms. If the symptoms last up to, let's say, 9th day, then you have to add 3 days to that 9. Or to be safe, you can add 3 days to the 10. So 10 plus 3, it becomes 13. So add a few extra days if your symptom has lasted longer. Or if you have finished 10 days, but your symptoms are till 11 days or 12 days, add 3 days to that, then it becomes 16 or 17. Many people may have some symptoms even persisting afterwards. But if it is fever or respiratory symptoms, then definitely you have to be tested why these symptoms are lasting so long. And then you have to be given further isolation. Non-symptomatic cases, 10 days after positive test, you can consider yourself recovered. You don't have to do any tests again. And the date of starting these 10 days of count is from the specimen collection date. According to the Department of Health, again, no tests are required to confirm recovery, but Department of Health requires quarantine and isolation for 14 days, not 10 days and not 10 plus 3 days from end of symptoms, but 14 days. This is just to make it simpler and also to be sure that you have recovered. So it's a safety. Quarantine and isolate for 14 days, at least. But after 14 days, if you have had no symptom, you are declared recovered by your care provider, you can go back to work. But when you go back to work, you still have to wear mask and shield, just like everyone else. You can't say, no, I have just recovered, I'm immune. No, you have to wear mask and shield. The reason is that in very small number of cases, you may still have the infectious virus, small number. So you have to take the precautions. Of course, you may not be coughing as much. Sorry, you may not be coughing at all. That's a sign of recovery. But even while you're talking, if there is some virus remaining, you may spread the infection. So when you cough, the virus goes further distance. But when you're not coughing, you don't have cough, you don't have fever, the number of viruses in our throat will be so less that just wearing this mask and shield would be enough. And you have to keep your distance just like everyone else. That's about 6 feet from each other. And that's like 2 arms length. That means when you spread your arms, both persons spread their arms, you should not touch each other's fingers. That's what is 6 feet. That's easy to guess. So maintain that distance at workplace, maintain that distance at home as much as possible, especially from elderly people and pregnant mothers at home. But of course, that's not always possible with our spouses, for example. But after 14 days, you can consider yourself recovered. And as long as you're not with high risk group people, you can move around. Clean hands and surfaces frequently. So these things that I'm showing on this slide is for everyone. It's not just for recovered patients, but also for everyone. We have to keep doing this until we have no drugs for COVID, until we have no vaccines. And there is no guarantee that vaccine is coming anytime soon. It may take 6 months, 12 months, we don't know. Let's be hopeful. But until then, at least do the things that I have shown on these slides, whether you are symptomatic, whether you're not symptomatic, whether you're sick or not. What to do if you were in contact with someone who is laboratory confirmed COVID case? but you're not sick yourself and not tested positive. So if you're tested positive and or sick, you have to do what I have mentioned until now. But if you're not sick and not tested positive, this is what you could do. Go home and stay home for 14 days. This is because tests, even if tests are negative, you may still have got infection. No test is 100% perfect. No test that is being used now, RT-PCR, even that only finds 70-80% of the cases. It may be false negative in, let's say, 20% of the cases, depending on when you did the test from the onset of symptoms. So you have to go home and stay home for 14 days. If you were within 6 feet of a person with lab confirmed COVID-19 for at least 5 minutes or had direct contact with their mucus or saliva in the past 14 days. So if you were in contact within 6 feet, more than 5 minutes. Some institutions say more than minutes. Okay, again, if you keep this distance, then you will be not labeled as contact. If you maintain this distance, you will not be labeled as contact in most cases, unless you're working in crowded settings. Then, well, even 6 feet may not be enough, especially if you're not wearing mask. If not everyone is wearing mask properly. Okay, so in that case, in contact, if you're a contact, go home and stay home for 14 days, as I mentioned. The date starts from last close contact with person who has COVID-19 and ends, the quarantine date ends as shown here after 14 days. Please note, if your quarantine starts at noon on day 1, then it would end at noon on the last day. What to do if someone else is sick? Now, this is important. This is my second part of my presentation, and this is important. Support them to stay home, plus consult a care provider and support rapid isolation from others. Help them to seek emergency medical attention if they have emergency warning symptoms and signs that I have already mentioned. Help them with grocery shopping and moral support. If they are staying alone, the healthcare provider may say, okay, it's fine, you can isolate at home, but somebody has to do the grocery shopping. Otherwise, this person will come out after 2 days and do grocery shopping and spread the infection. So do some shopping, but leave the grocery at the doorstep. And provide moral support. You have to do this for everyone, whether they are your loved ones, friends, or work colleagues. Call them up. Your workplace doctor needs to call them up and do a moral support. Otherwise, people get frustrated and they come out thinking that it's fine, I'm feeling better. But that's not so for 14 days. But you have to take appropriate precautions. As I mentioned, leave your grocery outside the door. Protect yourself. Limit contact. Like if you're a caregiver, if you are staying in the same place that's approved by the healthcare provider, like but a separate room, you may still have to provide care. But as much as possible, you have to limit contact. If you do contact, then you have to clean your hands for at least 20 seconds with soap and water and or with sanitizer. And the surfaces the patient may touch, the surfaces where others may then touch. Open the windows, try to stay at least 6 feet away from the sick. Not always possible if a person is elderly. That's why you have to clean your hands and then go back to your room. Continue to be supportive. The support you provide, the emotional support, the moral support, that will cure the patient more than any drug. Don't leave the patient like as if the person is untouchable, unapproachable. At least you should approach patients emotionally, morally. Otherwise, the patient will become frustrated and that will worsen the disease. And also the person may come out of his room or place of isolation. So WHO has published very nice advices for the public. I will not go into the details, but you can Google for these words: coronavirus disease, COVID-19 advice for the public. These are nice ones. Like for ill people, what has to be done, what the person should do, and then all members of the household, what they should do with the patient, and for caregivers, what they can do. So in these 3 charts, everything is explained. So have a look. Most of my ideas are from this. Okay, coming to the last few minutes of my presentation, what to expect from care providers. So these care providers are frontliners who may visit you for contact tracing and testing. They may request you to continue quarantine at home or isolate. Quarantining at home is if you're not sick or if you have tested negative, you're not positive. But isolation happens if, and you have, for isolation, you have to be separated from everyone for 14 days. And that happens if you're sick or tested positive, even if you're not sick. Isolation may be in approved homes. So your healthcare provider, barangay worker, or somebody like that will have to approve that you can stay at home. Or you may be isolated in a hotel designated for this purpose, or in TTMF. TTMF, as you may know, is temporary treatment and community facility monitoring facilities, also called isolation centers. Approved homes are those with separate room for the patient until he is sick for 14 days, separate bathroom, no elderly or pregnant mothers in the household, and then monitorable by barangay teams. Plan Kalinga focuses more on preemptive isolation, alternative to testing. So testing is important, but it's not mandatory. What is more important is to isolate. First isolate and then test, not first test and then isolate. No. As I said, testing is not perfect. Some of the best tests also may miss. So isolation is more important. The government says isolation centers are air conditioned, food and Wi-Fi are free. I have not visited them or I have not been isolated. So, but I understand that most of these places are really good as there can be. So don't be scared of going to isolation centers. Of course, some people who are working on daily wages, they have a family to feed. The government needs to take care of them, but don't be scared of going to isolation centers. Granular lockdown of specific containment zones. So if you're living in a condo, then your floor may have to do granular lockdown, or in a small community, in communities, a block may be locked down. It's all the discretion of the barangay to do granular lockdowns. Again, in this situation, please do not stigmatize, please do not discriminate against the person who may have COVID. Please don't throw them out. Please don't say that we will not entertain this person in this community. Doing all that, stigmatize, if you discriminate against people, if you stigmatize, then they will hide symptoms. People will hide their mild symptoms and they would continue to infect. So you have to be compassionate. What to expect from the government? That's my last part. So according to government slide, this is a slide from the government. There is something called Barangay Code. It's recently launched in a few barangays, and we are hoping that it will be expanded very quickly, because this is really promising and this can really stop COVID. So it's about prevention, detection, isolation or quarantine, testing and treatment. But this step is the most important. The testing in earlier plan, testing was before isolation, but now it's after isolation. So testing earlier was part of detect, but now it's after, because we have to isolate first and then wait for testing and their results. And there are some details, but you don't have to go through it now. And then there is a social amelioration program in these barangays. Family food packs are provided and other day-to-day commodities. So hopefully, as I mentioned, WHO will help the government to expand this quickly. So if you forget everything I have said, that's why I'm showing a green slide. If you forget everything that I have said, then just remember 4 things: mask, sanitize, distance, and information. Correct mask wearing, correct sanitization, correct distance, correct information. If you do these 4 things, you will protect yourself, you will protect your loved ones, your workplace colleagues, and of course, where required, you have to be isolated or quarantined. And this is all that is about this is what is BIDA campaign all about, all these 4 things. Thank you.
Thank you, Dr. Raj. Turning over to Tom and Harold.
Thank you, Dr. Albert. Can you hear me okay?
Copy? Yes.
All right. Good morning to all our participants in this webinar. My name is Harold Rete, and I will be first to present the part 2 of the session 3, which focuses on contact tracing in the workplace. My colleague Tom Hyatt will pick up with the presentation for some exercises afterwards. So our objective is that at the end of this session, you will be able to understand contact tracing, describe the responsibilities in contact tracing to prevent new cases, and lastly, to practice contact tracing and take part in breaking the chains of transmission in our respective areas of assignment. The outline of presentation are as follows. We start with the overview of contact tracing or CT, followed by CT in the workplace. Next is the discussion on how we can participate and be part of the solution. And last but definitely not the least is the exercise and conclusion. On your screen now is the National Task Force Revised Strategy for COVID-19 with the acronym PDITR: Prevent, Detect, Isolate or Quarantine, Test, and R for Treat. Contact tracing falls under the detect component. So what is contact tracing? Contact tracing is the process of identifying, assessing, and managing who have been exposed to a disease to prevent onward transmission. It is an essential public health intervention for controlling infectious disease outbreaks. And listen to this, it breaks the chains of transmission of a disease when systematically applied. Contact tracing is not new, no? It has also been used in many public health programs in the past. Infectious diseases such as tuberculosis, HIV, etc. And the approach just varies depending on the dynamics of the disease. Specific to COVID-19, we identify the people who have been exposed to SARS-CoV-2, the virus, quarantining them if they are close contacts, and isolating them if the close contacts have developed symptoms or if it is already a COVID-19 case, and following them up for 14 days from the last point of exposure. Dr. Raj has mentioned this in the last presentation. Just to reiterate the difference between quarantine and isolation, since many thought that these are interchangeable, they are actually not. Quarantine means limited exposure, meaning we advise the person to stay put, to not move, okay, whether it's home or in a quarantine facility, so that we avoid interaction with other people. Whereas isolation means that there is zero exposure. This is applied to symptomatic close contacts and to COVID-19 cases, may it be suspect, probable, or confirmed. So we already answered the what, no? Now, why do we contact trace the close contacts of the COVID-19 cases? It is because they are at high risk of becoming infected and of infecting others. How do we contact trace? We can do it in 3 steps that we will discuss in the next slide. When do we contact trace? As soon as possible. And who are these people who we should be tracing? It can either be some of your family members in the household, your friends, health providers, the community, and our work colleagues. Thus, we have this webinar topic. Now, how do we define a close contact? So number 1, face-to-face contact with the COVID-19 case within 1 meter and for more than 15 minutes. This is the definition directly lifted from the DOH policy on contact tracing. Number 2, direct physical contact, meaning you touch each other. So regardless of the time, even it's less than 15 minutes, you are considered as a close contact. Number 3, direct care for a patient without using proper PPE or personal protective equipment. So these are the healthcare workers and the frontliners. And lastly, number 4, other situations as indicated by local risk assessments, so that if the contact tracing focal person or the health personnel assessment is that your nature of exposure is of high risk, even if you did not fit in the first 3 criteria, you can be tagged and be in the close contact list. Now, we go to the process. The trigger to contact tracing is the identification of the case. The first step is to interview the case to identify and list all his close contacts and determine nature of exposure. In your case, the exposure will most likely be in the office or work area. Second step is to call these people, the close contacts, and inform them that they are close contacts. Profile them and as well manage the amplifying events. What are these amplifying events? These are places, avenues, or events where the transmission of the virus is of highest chance. It can be eating together in the pantry or something like that. No, we have to manage this by instituting measures such as disinfection or temporary closures of certain areas. And last is the management of the close contacts, rapid quarantine and or isolate and monitor for health status in the next 14 days. Now, let me explain further the two-pronged approach of contact tracing by showing this figure. Break the chains of transmission by subtracting 2 days from the onset of symptoms, and the days moving forward will give us the list of close contacts. Why minus 2 days? It's because based on study, this is the timing where the case have started shedding the virus and is actually infectious. Tapos na yung incubation period. What is the key here is to advise and ensure rapid quarantine or isolation of the close contacts in that list. The left side of the figure talks about the source identification. We gather information on the whereabouts of the case in the past 2 weeks to come up with the patterns that could lead us to where and even who the case could have gotten the virus. So you can see in this figure the explanation of the two-pronged approach of contact tracing. Now, let's zoom in the workplace context. Now, part of the joint memorandum circular of DTI and DOLE on workplace guidelines for COVID-19 is a section on contact tracing. It's in section 3 and number 3, contact tracing among the workforce. Employers are actually partners of the local health office in conducting contact tracing. So you can consider yourself as junior contact tracers, no? Assisting the local health office or the local contact tracing team. You need to ensure that those who tested positive in your workforce using RT-PCR undergo a 14-day quarantine. The employees who are close contacts should be reporting their health status during the quarantine period, and those who remain asymptomatic may return to work without the need for a test. Dr. Raj already explained about this. And lastly, work arrangements should be facilitated when feasible. Also in that section, there is a part on contact tracing of customers and visitors. So workplace managers should also be required to implement the contact tracing of customers and visitors using the contact tracing form. Information collected through this form should be treated with privacy and confidentiality. Contactless or digital forms can also be used, but we need to use it responsibly. So ladies and gentlemen, in contact tracing, we can also be the solution. No? This is the communication campaign of the Department of Health, Be the Solution. The goal here is the strong coordination between workplaces, occupational safety and health committee or staff, and the local epidemiology and surveillance unit or the local contact tracing team themselves, so that we can achieve, this is the key word, a speedy contact tracing. In contact tracing, again, speed is the key. We need to do it as soon as possible. We should not delay it. If we delay it, we defeat the purpose of contact tracing. And for employees, we can keep a diary of activity so that whenever needed, it would be easier for us to recall contact tracing information. By this, we help our contact tracers in gathering credible information and the complete list of close contacts. And lastly, we should keep this basic principle by heart. If you feel unwell, just like what Dr. Raj said, and you think there's something really wrong with your physical condition, please stay at home and do not force yourself to report to the office. Communicate with your supervisors and managers and monitor yourself for COVID-19 symptoms. I will stop here and I turn over the floor to my colleague. Take it away, Tom.
Thank you very much, Harold. Maraming salamat. So yung gusto natin here is to get to zero COVID transmission at my workplace. Yan ang goal natin. Pero okay, yan ang goal natin, yan ang destination natin, baka may ibang daan punta ron, right? So kung tignan natin one workplace na nakita ko dito, ano ba ang interventions na ginawa nila dito para ma-prevent yung COVID transmission sa workplace nila? So yung first, siguro nakita natin yung plastic nasa between yung staff and yung customer. Yung susunod, baka makita din natin hand sanitizer for staff inilagay dyan. Meron din hand sanitizer sa labas para sa customers. Mukha siyang automatic dispenser din para touchless. Tapos meron din silang policy, no mask, no entry. So policy level, pwede natin gawin intervention dyan. At nakapost siya dito, so may communication part din dyan. Nakikita din baka may policy for staff na hindi pwede mag-congregate or yung nakita natin kailangan may mask. Baka may policy din na go paperless. So walang touch sa paper approval process. So maraming ibang ways na makikita natin to mitigate and reduce the risk of COVID transmission sa workplace natin. Sa buong Pilipinas nakita ko maraming talagang magaling nag-invento ng ibang ways na pwede sila mag-prevent. Pero so hindi ko masasabi lahat na pwede niyong gawin. Actually, alam nyo, kayong kings of your castles sa workplace nyo, alam nyo kung anong pwede gawin, anong feasible, anong plausible, anong hindi. Pero we can discuss here, you can look sa ibang parte, infection control, kaya binanggit ko kanina, meron infection control measures. Kung hindi nag-work yan, na-fail yun, may contact tracing din. Nasabi ni Harold, kung paano tayo mag-contact tracing plus testing to mitigate transmission that has happened. And then meron tayong mitigation measures din sa workplace natin. For example, pwede natin i-modularize yung workplace for small groups of employees na mag-interact or with distance pa rin, pero they have dedicated entrance, dedicated time frame. So kung meron transmission, yung module na lang kailangan mag-quarantine shutdown, pero hindi yung buong workplace. So may mitigation measures baka pwede din. So this is of course the focus of yung OSH office. Tapos yung mga managers din, pero yung mga employees too, may role din sila dito. Kung employee kayo, meron kayong nakita, ito, baka high risk itong situation sa workplace ko, ibanggit nyo sa manager nyo or sa OSH para baka pwede sila magawin yung mitigation measure dyan. So paano natin i-assess kung anong dapat i-change natin or mitigate natin? So WHO recommends workplace risk assessment. So yung risk assessment actually baka kabisado kayo rito sa ibang risk assessment, comparing likelihood na mangyayari with severity kung mangyari yun. Alam natin COVID-19 outbreak can be very severe. Mabilis siya ma-spread. So kung hindi siya nag-contain, the whole workplace will be shut down very quickly. Nakita natin yun. So that's one we can do and then mitigate yung risks niyon. Yung second na binanggit ni Harold kanina is yung pre-mortem. So kung hindi nyo pa narinig ito, ano bang pre-mortem? We'll start tayo sa mortem. Ibig sabihin patay, which is malungkot pero importante. So yung post-mortem, ano siya? Exercise siya ng mga health staff. Kung merong pasyente namatay, nag-conduct sila ng post-mortem para mag-usap, paano siya namatay? Anong nangyari? Anong pwede natin matutunan dito para hindi mangyari na naman? Yung pre-mortem naman, actually before yung patay. So medyo tongue-in-cheek naman ito. Pero isip natin, imagination lang na ma-fail ito. So hindi kailangan patay, pwede din fail ng project or ibang failure. So kung sa situation na to, siguro isipin natin, okay, halimbawa, ngayon, December 2020, meron tayong outbreak ng COVID-19 sa workplace natin. Meron tayong 45 patients, 45 staff naging patient ng COVID-19. Anong problema? Anong nangyari? Bakit na-fail ito? And then pwede natin i-muni-muni yon kung anong mga possibilities na nangyari yon. And then i-mitigate natin yun para i-avoid natin yung catastrophe na yun. So yung pre-mortem, maganda siya kasi medyo imaginative yun. Pwede isipin natin, ito, baka pwede ito, baka pwede ito. It avoids bias naman kasi yung, siyempre, bias tayo lahat. Gusto natin to be positive, to be successful. Pero this assumes na hindi siya successful. So parang tinanggal niya yun. So we can focus more on what pwede might happen. And tapos engaging siya. So we imagine it's scenario lang, hindi siya malungkot yet because siya, kunwari lang. But it allows us to have a broad look at yung situation natin there. So with that, maraming salamat po sa inyong attention.
Maraming salamat, Tom. Sabi po sa inyo, hindi tayo nagsiscripted. Nagtatagalog po ang aming kasamahan na si Mr. Tom Hyatt, an epidemiologist with the WHO Country Office in the Philippines. All right, we are now in the portion where we will have a moderated question and answer. And while Dr. Raj and Harold and Tom are all discussing, ang dami na pong pumasok na questions, quite a lot. But before that, actually, I've been asking the original plan is really 30 minutes lecture, pero there's such a lot of information that we really want to extend a bit. So we will extend a bit beyond 12 o'clock, and that's fine because not to worry, when we start asking the questions, a lot of these will be answered. Before that, I will be asking, I know I briefed our panelists, Sir Alan, Mr. Richard, and Ms. LV, that I'll be asking for brief interventions. But because in the interest of time, and there are a lot of questions, and not to worry, I will really field questions for all three of you. Can I ask only for now, Mr. Richard Cohen to give his brief remarks from the perspective of the private sector. I'll just introduce Mr. Richard Cohen. Richard Cohen works for Maxim Integrated as Vice President managing the Asia factory operations in Philippines and Thailand with 1,000 employees. Maxim Integrated is a semiconductor company with headquarters in San Jose, California. Richard, can you tell us how Maxim is handling the COVID-19 situation and what are you doing or what will you do if there is someone sick in your company? Over to you.
Yep, sure. And thank you very much for giving me the opportunity to be a panelist today and speak. And I'll go quickly because I know we're short on time. So I just want to briefly share our practices from when an employee starts their journey to work and then through the day with those on the call today. And I also want to mention that these practices are not unique to Maxim. We share our practices with our other PESA member companies, and most of them are doing very similar things. So let me share, and we'll start the quick presentation.
All right, we can see.
Hopefully you can see that now. So we'll start with the journey to work starts on the shuttle bus to Maxim, where we have the process of wearing mandatory face masks and face shields. We temperature screen everybody that's entering the bus before they get on.
Richard, sorry, can you speak louder into the microphone?
Sorry, yes. Okay, is that better?
Yes, thank you.
Okay, so we start the journey to work on our shuttle buses where everybody's required to wear face masks and face shields, and we temperature screen the people before they get onto the bus. We've converted the AC intakes to fresh air, and we disinfect the buses after every trip. And then when an employee arrives at our entrance, they go through a shoe disinfection mat. They have IR temperature screening again, and an automated health check questionnaire that they have to tap into and acknowledge that they're not having any symptoms during that day. And then the employees themselves have all been given free face masks that are 3-ply with a non-woven layer, face shields, and also are given on a regular basis IPA with free refills, isopropyl alcohol 70%. We allow flexible work schedules, and there's just a constant barrage of information going to our employees via email, text blast, social media, paging systems, and other ways. And then once they're in the office area, we put up dividers in our office cubicles for those that work in the offices. We're maintaining a minimum of 6-foot social distancing. And all of these areas have isopropyl alcohol for regular cleaning that we ask our employees to do. When they do eat in the cafeteria, which because of our workforce size, we are required to do, we've reconfigured our cafeteria to maintain a 6-foot minimum spacing and put acrylic barriers around all the eating spaces. And then after a person eats, then there's actually a tag that they flip over to say the space needs to be cleaned, and janitorial staff will come in and disinfect that space before another person can sit on it. There's also, as you probably can see, an alcohol bottle at every space so the employee can self-clean also to make them feel really comfortable that they're in a safe spot. And then finally, there's constant disinfection and cleaning that goes on throughout the factory. We have a schedule that actually starts with every 2-hour cleaning for high-touch surfaces, and then we have some things that are cleaned every shift, some things every day, and then a a very thorough disinfecting of the factory on a weekly basis. So all of that's done to keep the workplace safe. And so what I want to emphasize is that we're really not waiting for a COVID-19 case to happen in our factory and then act. The practices we have in place are to continually disinfect and prevent any case that might be brought into our factory from being transmitted, so that when a positive case is identified, we've already done all these things and we're confident that our employees are working in a safe workspace. So thank you. Thanks for the opportunity to share that.
Thank you, Richard. And I just wanted to echo Richard's very good message there. They don't wait for COVID to show up. They continually prevent. It's not about catching the case when it happens. It's about keeping the case from happening in the first place. And just a quick follow-up question, Richard. And does this mean that operations continue so long as you keep on doing these preventive measures?
We do, as long as when the COVID case is identified as a positive, as long as these cleanings have already happened, which they always do, then we continue with operations because that disinfecting and cleaning's already occurred.
Thank you, Richard. All right. So having said that, we will now go straight to the moderated question and answer, and I will be alerting our fellow panelists. First, let me introduce to you Mr. Alan Datahan, who is the Philippine Economic Zone Authority Deputy Administrator for Baguio City Economic Zone. He is with us, Sir Alan. Hello, good morning. And then our other panelist is Ms. LV Cachero, a registered nurse and occupational safety and health officer 3, facilities supervisor of Adriste Philippines Incorporated. So remember the framework that Dr. Raj and Harold showed, the prevent, detect, isolate, test, and treat. I'm gonna fire an initial salvo of questions along that framework to get the to get the panelists warmed up. I, as moderator, will be quickly answering 2 short questions on the prevention side, which should have been answered by the previous webinars. For example, Marcelo Botenes has been asking, in Bida Solution, we need 1 meter distance, but in this session today, we heard that the distance is 2 meters. So which is the correct distance? Ladies and gentlemen, the further you are, the better the protection. The 1 meter is the minimum required. So when you hear us speaking 2 meters here, it doesn't mean that you have to stay at 2. The minimum is 1, but you're actually safer at 2 meters. Marcelo Botenes is asking, is breathing steam of salt water. So can breathing saltwater steam help fight COVID-19? The quick answer here is it does not cure COVID-19. It may relieve the symptoms. It may actually improve your breathing, but we still advise that you consult your healthcare professional, your OSH nurse or doctor if you do have symptoms, because we don't want it to worsen. And now I think the first question I'm going to fire off to Sir Harold. Harold is now surprised. He was not expecting that, but it's a contact tracing question. Ina Rodriguez is asking, if the employee confirmed positive in the workplace, what will be the process for contact tracing? Does the company need to report to the rural health unit? Or who's going to do the contact tracing? The local health officials or the company? Sir Harold.
Hi, Dr. Albert. Thank you, Ina, for that question. We can start the initial contact tracing. No? The company, the OSH committee, can interview their employee. But very important is to coordinate immediately with your local health counterparts. It can be the barangay health center or the local ESUS. So the local ESUS will complete the full-scale contact tracing, but from your end as the OSH committee, you can already start doing the initial process of contact tracing.
Yes, Harold, is there a form that they can use or they can download? Because one of the frequently asked questions is, do we use the contact tracing line list, or is there like a Annex C or something to the CIF? What form will they use? Over.
Yes, Dr. Albert, it is available from the DOH policy on contact tracing. There's a close contact line list form, and at the same time, there's a close contact monitoring log sheet form. So you can download it from the DOH website.
Right. So thanks for that, Harold. So that was the answer to Davidson de la Cruz question on, do we use a log sheet for contact tracing? Now, all right. Charlotte Chua, this is probably related to your answer, Harold. Charlotte is asking, Susana Sevilla is asking, in the office, Sino ang mag-inform? Who will inform the contacts? Will it be human resources, the contact tracer of DOH? So we're speaking of the close contacts. We know who the confirmed case is. Who's going to inform the close contacts?
Okay, katulad nung sagot kanina, Dr. Albert, no, initially the company OSH can inform the close contacts ng employees nila, but as they coordinate with the local health counterparts, they will also call these close contacts and will inform them of what to do, where to quarantine, and what to watch out for. So same thing, you can start that contact tracing step, but at the same time, the local health office, the local contact tracing team will also be doing that to reinforce that the appropriate contact tracing measures was done.
All right, now I'm gonna go over to the Q&A box inside. The time is 12 o'clock, but this is really a very informative Q&A happening here. Sorry, Sir Alan, the video was blocked earlier, but you're back here with us. So you can see on screen.
Dr. Albert.
Yeah, Deputy Administrator Alan Datahan. Sir, I'll go straight to the questions. Ito na, para talaga sa PEZA, the question. Ms. Jambelin Ikamen is asking, previously, PEZA had advised that medical certificates would be required prior to returning to work. Given the changes already and that most of the country is now under MGCQ or GCQ, the question is, will it be okay to no longer require the medical certificate from employees prior to returning to work, considering they will also have to complete the symptom checker survey every day prior to entry to the office? Kailangan pa ba ng MedCert, Sir Alan?
Yeah, Dr. Albert, thank you for that question. Basically, we have to rely on the joint memorandum circular issued by DOLE and DTI, wherein it is stated there that asymptomatic employees prior to physical returning to work may be cleared by the local health officer or the OSH physician. So that's our stand in PEZA right now.
So kailangan talaga ng clearance. And I think we need also to emphasize, ako rin po as a doctor myself, this is not just a paper requirement, because a lot of the symptoms, actually there are quite a few questions, hindi ko lang tatanungin. They're asking, what's the difference? Maybe I'll ask Dr. Raj. Dr. Raj, one of the questions I've been seeing in the chat box on YouTube is it easy to differentiate the symptoms of the common cold from that of COVID-19? I think this is related to the reason why government is asking for medical evaluation. How related are the symptoms between common cold, the usual seasonal flu, and COVID-19? Dr. Raj.
There are many common symptoms for all these three: common cold, flu, and COVID. But generally, the COVID has more of fever, high-grade fever, and cough. So that's more common. And it said that COVID is like a bad flu. So symptoms are worse than a normal flu. But as I have mentioned previously, some people may have very mild symptoms, and then in that case, they may be like flu or even common cold.
Right. So as you can see, as you have heard, this is the reason why we really ask employees to please seek consultation with their physicians or nurses. And I see a company nurse among our panelists. Adristes, Ms. LV Cachero is an occupational and safety health nurse. And my question, actually their question, Ms. LV. So Luis Abello is asking, we have come across workers who feel symptomatic and attempt to isolate themselves. So sumusunod sila, they want to isolate. However, they end up having nowhere to go to for fear of contaminating people in their tiny homes. Have you had this experience before? If not yet, or if you did, what do you think should be the advice for this? They want to isolate, but their house is not big enough. They cannot do physical distancing. There's no individual room. What did you do, ma'am?
Sir Albert, good morning. So, yung question niyo, sir, is yung nag-symptom siya, di ba? And then, wala siyang place to stay para mag-isolate. So,
Yes.
what we do, sir, kasi dito sa amin, as we implement the company policy, we do referrals, sir. So, kung wala siyang place to stay, we do referrals. Dito kasi sa City of Baguio, we have accredited facilities wherein we can refer patients there. Doon sila mag-treat or mag-isolate. So, yun yung tinatawag natin na facility quarantine. Na they will be observed there for 14 days. and then they will be given clearances para kung wala na po silang signs and symptoms, then they can come back to work, presenting that completion of quarantine. So, ganun po.
Thank you, Ms. Elvi. No? So emphasis on the facility-based isolation or quarantine and highlighting that the company of Ms. Elvi, Adriste, is in direct coordination with the local government unit for these isolation facilities. Follow-up question po, Ms. Elvi, from Reggie C. Once someone in the workplace tests positive, do you start the 14-day quarantine of all contacts, starting from the last day of exposure or when the PCR results come out? So, kailan tayo nagbibilang ng 14 days? From the last day of exposure or from the day of PCR results? Ms. LV.
Sir, we immediately start after the last day of exposure. As per DOH, yun kasi yung sinusunod natin. So, nasa guidelines po yun ni DOH na kapag yung last day of exposure, yun yung start ng 14 days quarantine. Ngayon, yung contacts natin, ganun din, sir. We have them isolate themselves for 14 days. Or kung choice nila, gusto nilang magpa-swab, kung nag-negative sila doon, then we can accept them back to work agad. But if not, gusto nilang mag-complete ng 14-day quarantine, okay lang din po yun. So that's what we do, sir.
Thank you, Ms. LV. So you already mentioned about testing. Pumasok na tayo sa usapin ng mga swabbing and testing. This next series of questions is for Dr. Raj Yadav because this is a very frequently asked question since day one. And I think today I've been promising them, Dr. Raj, I said yesterday and the other day, wait until Dr. Raj answers your question. And here comes the questions. So Joe Tree is asking, how can you explain a negative swab test but with symptoms? Negative swab test but with symptoms like sore throat, sticky phlegm, and problems with the throat. So is it possible to have a negative swab test but with symptoms, Dr. Raj?
Yes, there are many reasons why a person may have symptoms but negative swab test. The one reason is that the person may not have COVID but something else like common cold or flu. The second thing is that even if the person has COVID, the negative swab sample may be because none of the tests are 100% perfect. Like depending on when the test is done, if you do test on day 1 of your onset of symptoms or day 0, then the RT-PCR, which is considered as the best test, is only 80% sensitive. So 20% may still be missed. And then if you do it on 3rd day or 5th day, then the percentage goes down and you may be missed. So there are these two reasons.
Right. So just to emphasize what Dr. Raj said, it's really in the timing. And this is the reason why we will always say consult your health professional. It's very important that you get the sample properly and also on the right day. Otherwise, the result might not be reliable, which somehow answers what Miss Louise Flores is asking in the chat box, conflicting results, one lab negative, another lab positive. It could be different days, but if on the same day, it could also be on the technique. Dr. Raj, what about the other way around? Milagros Lapiro is asking, how about a positive swab test but without any symptoms? Positive swab test but no symptoms? How is that possible?
Yes, so those people are called asymptomatic or non-symptomatic. So these tests are very specific, meaning if they are positive, the patient is actually has COVID. That's for sure. But the person may have no symptom because the body is fighting off the virus very nicely. But the person may still infect others while the body is trying to fight the virus.
Thank you, Dr. Raj. And this is the last question, at least for this series for you. And I think this is one of the most awaited questions. Ryan Pinpin is asking, is it safe to assume that a patient has recovered after 14 days of isolation, even without RT-PCR testing? In the US, they reportedly have a patient that tested positive after a few days, tested negative, and then positive again after a few days. I think this pertains to the discharge criteria by WHO and DOH. How safe is that, even without repeat testing?
So actually, how it also comes to the question, how safe is moving around or mixing with people who have no symptoms? So people without symptoms are also maybe infecting. So we have to do the BIDA, the 4 things of the BIDA campaign anyway, irrespective of symptom or no symptom, test positive or test negative. But a person after 14 days, how sure are we that the person has recovered? we can be like, let's say 90, I should not be putting a figure, but we are very confident that a person after 14 days has become negative. But if the person has to go to a workplace where there are very high risk groups like cancer patients or cardiac patients, then ideally the patient should not be allowed to come. This person, recovered person, should not be allowed to come with very high risk groups even for some more weeks. The tests are not reliable at all. If you do RT-PCR at the end of 14 days, it's going to be false positive for 40% of the patient because it detects even the dead viruses. So that's why WHO does not recommend RT-PCR at 14 days.
Thank you, Dr. Raj. So malinaw yun, no? The PCR can actually detect something which is no longer infective. Napipick up niya yung parte ng virus, pero it's no longer a virus that can infect. Let's go away a bit. So the time is 12:10. Ang oras natin ay alas 12 Gs ng hapon at magandang hapon sa lahat sa buong Pilipinas. But let's extend a bit. I'm sure you're still waiting for more answers. I see Tom at tatagalugin ko na si Tom dahil impressed na impressed sila, Tom, at paano ka daw nagtatagalog ng pati yung mga pagbibiro namin, nakakasunod ka. So, tanungin kita sa Tagalog, anong pinagkaiba, Tom, ng Pure Force app tsaka nung RC143 app?
Ayun, magandang question yan. Pero sa totoo lang, i-confess ko sa inyo, hindi ko narinig yung RC143. Paki-paliwanag, Albert. Alam mo to?
Yung RC143, ito yata yung sa Red Cross. Meron silang app na ginagamit rin. So siguro yung general answer nilang, bakit ng Pure Force yung ating recommend based on DOH kumbaga guidelines? Ano pa yung purpose ng Pure Force? At
Nag-commute ka. So yung Pure Force sa alam ko na ni-recommend ito ng DOH because this is really the emergency app ng government sa ngayon. And managed ito ng private company and actually experience ko rin, gaya ni Doc Raj, super responsive sila. So pag i-download nyo yung app, there's of course police, fire, everything. Siyempre ano lang, like the 911 call, nandyan yun. And they're really quite responsive with that. So itong recommendation ng government, download nyo yan. Even if you tap for advice, kaya ng sabi ni Raj, they're quite quick to respond. So it's a really good emergency response app. Baka maganda din yung RC143, but this is one recommended by DOH.
Salamat, Tom. So now babalik ako kay Deputy Administrator Alan Datahan, sir. Ito po, I realized that you might actually have the answer, pero kahit po ipaliwanag niyo lang po siguro kung ano yung usapin, mga current discussions, no? At tanungin ko na yung question. Marisa Esperal is asking, should non-regular employees subjected to 14 days isolation be excused from work and still receive salary for the 2-week period? Kaya ako po tinanong to, sir, kasi isa sa mga napipick up namin sa WHO ng dahilan kung bakit sila pumipilit pa rin pumasok, natatakot sila dun sa compensation, no? So this is one of the reasons, sabi nga ni Marisa, this is one of the reasons why some employees do not disclose to employers once they get exposure to someone who is infected. What is the status of this discussion, Deputy Administrator Alan, sir?
Okay. Director, Dr. Albert, just recently, I think last week, we had our joint consultative meeting with DOLE and DTI regarding the joint memorandum circular. And they said that the employer we're being encouraged to give leave for those non-regular workers accordingly. So hopefully, reading between the lines, maybe they can pay as what the dollar mentioned about.
Thank you, Sir Alan. I actually, so I would like to explain to everyone, sa lahat ng mga nakikinig at nanonood, I can see the intention na gusto nila, Sir Alan, ng gusto ng PESA, gusto ng DOLE ayusin to. But as you know, when it comes to labor matters, it's always a discussion between labor, employees, and all that. So we're looking for the right balance. But I can feel the sincerity of government here, represented by Sir Alan, that the discussions are ongoing. That's why the question I ask is, what's the status of discussions? All right. So another question naman po. Ito naman po, I'm going to ask this question in general for Harold. So Dave Santos is asking, hi, I'm Dave Santos from Safeway Philtech. If an employee is working from home and has not visited the workplace, so working from home, was tested positive, do safety officers of the company still need to report it to DOH and the CESU? Working from home, tested positive, who gets to report or who has to report the case? Sir Harold.
Thank you, Dr. Albert. For that question, no, once lumabas kasi yung test result niya, papasok yan sa database ng Department of Health and it will be transmitted to the local health offices. And probably it will take time, no? Since time is of the essence of contact tracing, I think if you already know that there's a positive patient kayo, kahit nag-work from home lang siya, we can still endorse that to our local counterparts kasi we'll just take the initiative and we're doing a favor for our local health team since may ginawa na tayong proactive action on that regard. So pwede po natin i-share kahit work from home. Ang mangyayari lang, yung close contact list niya, wala siyang exposure sa mga kasamahan niya sa trabaho. Thank you, Dr. Albert.
Thank you, Sir Harold. And ang oras natin ay alas 12:15. The time is now 12:15 in the afternoon. And thank you so much to all the 500 still inside the Zoom room and 2,524 on YouTube watching us. This is the last question before I ask our our panelists for final remarks. I'm going to direct this question to Mr. Richard Cohen, sir. So, Fraulein Roa is asking, what could be an effective way to lessen the stigma against probable or confirmed positive COVID-19 cases? She's asking, especially in an office of less than 100. I'm asking you, Richard, because you have a huge office and I can see that you're still running. So how have you been managing stigma when it comes to working with someone who may have COVID-19? Over to you, Richard.
Yeah, right. That's a very good question. I mean, I think when we had our first case, there was a strong reaction. A lot of people panicked over it. And over time, as we've had a few more, that's changed a lot to where there's not that reaction anymore. And the reason for that is we've spent an amazing amount of time speaking to all of our employees in small groups of 10 or less, going through all these practices I took you through and convincing them that if we just follow our practices that we've outlined in the factory, we won't transmit the virus within the factory, even if we have a COVID positive among us. And we teach people to basically act as if everybody has the virus. And if you act that way, then the likelihood is you're not going to get it. And so it's a long drawn out process of educating the workforce and convincing them that they're working in a safe environment if they follow the practices laid out for them. And we're fortunate in Maxim that they do.
Thank you so much, Richard. So wise words over there. Act as if everyone has the virus when it comes to prevention. So it's really the secret to keeping your business running. This is me reading between the lines of what Richard is saying. The secret to keeping your business running is really to prevent COVID-19 infection and be ready in case there is an infection that happens, which we heard from Adriste's nurse, Ms. LV Cachero. They are in touch with the local government unit. They know the reporting channels. They know what to do. They know where to isolate an employee if in case the employee doesn't have isolation capabilities at home. And then we heard from PEZA Deputy Administrator Alan Datahan that, yeah, PEZA is requiring these documents, not for the sake of requiring documents, but because it's tied to the evidence behind the symptoms. They just really want to make sure that businesses that you are able to run, the business owners, and for those of us who are working, that we still are able to go to work uninterrupted. The time is 12:18. We went over time, but as with the previous 2 days, the discussion has been like very fruitful. I have not had the time to read all questions. So what's going to happen now is I'm going to show the QR codes for where you can get the slides. Another frequently asked question is, Doc, pahingi ng slides po. So let me just flash to you the QR codes where you can get the folder from where all slides. And I'm going to use this opportunity also to please ask for your feedback. The QR code at the left is for feedback. So please scan it and visit the site for your feedback for today's session, day 3. And then the middle, so this is already up. The middle link is for the YouTube recording of this session. In case you have colleagues who did not make it to the 11 a.m. or who arrived late, that's fine. You can watch it again or even at another time. And to the right would be the QR code for all slides. It's a shared Google folder where we upload all slides at the end of the day. Having said that, thank you so much to all our speakers and panelists. I think we in WHO will not give any closing remarks anymore. But can I ask in this order first, Miss LV, then Richard, and then Sir Alan, for any last words of advice, remarks, Miss LV.
Hello, thank you, Doc Albert. From Address the Philippines, we thank you, World Health Organization Philippines and PEZA for inviting us and sharing our practices here in our facility. Just a word from us, ano lang po, to prevent this from the workplace is basically awareness. Because we can control our people in the workplace. But when they go home, ibang usapan na po kasi yun. So, we have to encourage them, teach them, educate them the severity of the pandemic para ma-implement din nila sa bahay nila. Kasi pag paulit-ulit ng ginagawa, nagiging ano na lang yun eh, parang autopilot na yan sa kanila. So that's what we do, awareness. So thank you.
Thank you, Miss LV. And then on to Richard. Any last words of advice or guidance, please?
Yeah, so very similar to Miss Elvie. I think it's in our power as people that run factories in the Philippines to keep our people safe. We know how to do it. We just have to be very disciplined about doing it. And we have to understand that it's inevitable that people will get the virus outside of our factories. So it's up to us to make sure that it doesn't spread within our factories. And we can do that. We are doing that. And I hope this information today helped people in their ability to do that in their factories as well.
Thank you so much, Richard. And over to Deputy Administrator Alan Datahan, sir. Any last words or advice for our public, sir?
Yes. Before I will give my parting words, thank you so much, WHO, Director Albert, and the rest of the group. Thank you also, Adresti, PEZA Locator, as well as Sir Richard from Maxim also, PEZA Locator. I have noticed that since day one, I've learned acronyms, the 3 C's: avoid closed spaces, and then avoid crowded places, and then avoid close contact setting. So we used to have acronyms. And then the second day, I learned the BIDA from the DOH. Maybe for PEZA and personally, you ought to know Alan. Alamin ang ligtas na pamamaraang labanan at lutasin ang COVID-19. Naway maibalik ang matligaya at malusog na buhay natin. With that, thank you so much, WHO and the rest of the group.
Thank you so much, Sir Alan. So having gone through our 3 panelists, again, my name is Dr. Albert Domingo from the WHO Philippines Country Office, together with my colleagues, Dr. Rajendra Yadav, Mr. Tom Hyatt, and Mr. Harold Doroteo, and our 3 excellent panelists, Vice President Richard Cohen from Maxim, Deputy Administrator Alan Datahan from the Philippine Economic Zone Authority, and Ms. LV Cachero from Adriste. We like to wish you all a good day ahead. Stay safe at maraming salamat po sa inyong lahat. See you tomorrow, 11 o'clock again, this channel. Bye-bye.